Righty, so what are we doing now?
An extended abdominoplasty.
An extended abdominoplasty is right, huh? And do you see any bleeding?
No bleeding.
Uh-huh. And we have Shania here. She's an extern, right, Shania?
Yep.
And you've seen surgery before?
Yes, one.
Yeah, very good. Alrighty. Not with us, right?
No.
And when you see this cut, what do you see different from what you've seen in the hospital before? Do you see anything different we're doing? When they cut in the hospital, when they did the C-section?
Yeah.
What you would see different than you see here?
If I can remember, it was
You can't remember, huh?
yeah, it was so long ago.
You're just a surgical tech student, right?
Yes.
So you're an extern here, okay. When they cut, do you see like that, or do you see bleeding?
I didn't see bleeding. I didn't see bleeding yet. They did go through multiple layers.
In the C-section, there was no bleeding.
Eventually, yes.
Eventually, yes, huh? Okay. Here, do you see any bleeding?
No.
No.
Not
Not
yet.
yet, huh? Okay. Let's see. Thank you. So what we see here is superficial fat, scarpus fascia, deep fat, and what is this right here? This membrane is the abdominal wall fascia, right? Shania, so we're now inside. Where is the blood that you were talking about?
I don't see it.
Oh. So you told me that once we went inside, we're gonna see some bleeding. So where is the bleeding? I got you laughing, huh? Yeah, very good. So this is a very unique technique here at the Cosmetic Surgical Center of Cerrito, where we operate and there is basically no blood loss to speak. Incredible, much less risk of anemia, much less risk of bleeding. I was at the supermarket yesterday and I ran into a lady and she said, I've been wanting to do a tummy tuck for a long time, but I'm afraid because I have anemia. I said, you know what, that's a good thing that you're afraid, but you should come and visit us. She goes, oh yeah, I've seen it on television, I've seen patients of yours and everything. But I didn't know that you operate without bleeding. Yeah, I'm gonna give you a call. See, I was in the supermarket yesterday buying some goat. I'm gonna do some birria tonight. Birria. Ooh, you like a birria? Yeah, birria. So I got it all done already. Look at that, huh? Do you do birria for your when your mom and Sylvia? You have. You do weddings and stuff, right?
Yeah.
And your mom does the birria too, right?
Yeah,
Yeah, man. So I love the birria. So it's a goat. Yeah, so we're gonna have some goat tonight. Very good. Yeah. So but see, no bleeding at all here at the Cosmetic Surgical Center of Cerrito. A very unique technique. It's good for the surgeon. It's good for the patient, like that patient that had anemia. Of course, we want to optimize the patient's condition prior to surgery, maybe find out why is she having anemia. A lot of times, women have anemia because they bleed too much when they have their menses, the menstruation. Every month, they bleed too much, and usually that's the reason. They may have like myoma or fibroma in the uterus, It's usually a benign tumor and may cause for them to bleed too much. But, usually you have to correct the cause of the problem, Take the myoma out, right? And treat the anemia with iron, right? This is iron deficiency anemia. And then once the blood count is normal, then we can do surgery safely, right? But the nice thing about this is that the risk of anemia is minimal because there is no blood loss. to speak of, right? Normally with this surgery, you're right, you bleed. Like you said, once you go inside, they're gonna be bleeding, right? But not really, right? Not with us. And so, why? Because this is a very special technique. Much less risk of anemia, much less risk of bleeding, much less risk of reoperation for bleeding. The patient is going to have a lot more energy. So the patient is going to walk. When they walk, our patients typically walk about 1 mile the first day, 2 miles the second day, 3 miles the third day, preventing a blood clot. A blood clot is the thing that can kill you. We never had anybody die. We want to keep it that way. So, and the reason why they can walk also is because they have no pain or very minimal pain. Why? Because this numbing medicine that we put in here is incredible. Not only it helps because it has epinephrine and it clamps down the blood vessels, so when we operate, there is minimal bleeding like you can see, but also they're gonna be pain-free, so they're gonna be full of energy, and they're gonna be walking and preventing the most lethal complication, which is that of a blood clot. That's the one thing that can kill you. We never had anybody die, and we want to keep it that way. Thank you. Belly button right there, and we're going down the midline, right? And this is an instrument that burns the skin, but in this case, it's not really a big problem because we're going to throw all these away. Everything that you see here, we're gonna throw away. So what we're grabbing right here is called a specimen, and this is what she doesn't like, so we're gonna throw it away. So basically we have a medical waste management company that comes and disposes of the specimen. In other words, they come, they pick it up, and they dispose of it, right? But what I want you to see here is like what Shania was saying, right? That she's expecting to see some blood once we go inside. She didn't see any blood when we're out. And now do you see any blood inside, Shania?
No.
So what are you thinking? I got you laughing, right?
Yeah.
Yeah, it's incredible. Because there is absolutely no bleeding. See, and I got through the tissue and there is absolutely no bleeding. So this is a very special and unique technique. What you're seeing here, the Cosmetic Surgical Center of Cerrito, right? And we're gonna go around the belly button, and we're gonna make we're gonna keep her own belly button. So we're not going to remove it in any way. And this burn edge of the belly button, however, we will remove so that she heals well. It doesn't heal with a burn, right? So this burn edge we are going to remove later with scissors, and we'll show you how to do that. But in the meantime, what we do here is we're gonna keep her own belly button. Some surgery techniques call for the amputation or removal of the belly button. And
This is specimen Dr. Patino removed from the patient's left side. Notice the complete absence of bleeding and her stretch marks are gone.
Oh, nice. She'll be happy. Thank you.
This is the right side that we just took off. There, you see there's no bleeding. All the stretch marks are gone.
Thank you.
righty, so what are we doing?
Creating a new home for the belly button.
Yeah, so her own belly button is inside, but the skin and fat around the belly button we already removed, right? So now her own belly button, which is inside, is gonna come out through this new skin, and of course we cannot burn this area, right? So I go down to dermis. This white membrane here that you see is the dermis of the skin, right? The dermis of the skin usually doesn't have much blood vessels, so I do this for the sole purpose of eliminating bleeding, right? And so now this is electrocautery. This one burns, right? Like you saw, the inside was burned, right? But here we gotta be very careful. So another reason why I like to de-epithelize this area is because I leave a white rim of that dermis to protect me from burning the actual skin, right? So I'm very careful, and what Sylvia is doing, she is cooling the area with room temperature normal saline, right? because this can easily burn the surrounding skin. We don't want any burns, right? And so that's my finger. So see, I love this part. Hello. Good. Huh?
Thank you.
So we did the rectus plication above and below the belly button. It's a double rectus plication for those doctors watching out there. It's a figure of 8 O proline for the deeper suture and a running O proline suture. And we trimmed the edge of the belly button. Now she's nice, flat, and tight. Thank you. Wow, so look at her. She looks absolutely beautiful. This is a tummy tuck with 0 liposuction, yet you can see the semilunar lines on either side and a little bit of the linea alba. It's a high definition look with 0 liposuction. It's just a tummy tuck. Look how beautiful that belly button is, how natural, sinking in nicely. She can go on a tongue, and all they will see is a beautiful natural belly button with no signs of a tummy tuck. Here at the Cosmetic Surgical Center for Cerrito. We'd love to see you. Thank you.